Good afternoon, my people. I hope you have had a fantastic day. Mine too has been a good one. We are still talking about diarrhea. We were discussing a very important subtopic about how to take care of a sore bum as a result of diarrhea, especially in young ones or babies who are prone to this sore bum because they are always on diapers and their light skin or their tender skin or sensitive skin, we can say. And before I continue, my people, thank you for the far you have taken me, the subscriptions, the likes, the comments, which are always positive and keep me going. Let's continue encouraging our brothers and sisters to subscribe. And when you subscribe, don't forget to put the notification bell on so that whenever I upload any video, YouTube will automatically notify you. When to see a pediatrician for a baby bum, or when should you see a doctor when your baby is having a sore bum, or what we call baby bum, or baby bum soreness. Diaper rash usually is not a serious condition and goes away with home remedies. Diaper rash is not always a serious condition to young ones and goes by itself by the use of the home remedies. However, it's important to schedule an appointment with your child's pediatrician if you notice signs of infection such as the following. Let me repeat this one because it's very important. Diaper rash is not always a serious condition. It goes away by itself when you apply the home remedies. However, it's important to schedule an appointment with your child's pediatrician when you see or notice signs of infection such as number 1, blisters around the diaper area, fever, pus or discharge from the affected area or the diaper area, rash that doesn't respond to treatment, rash that spreads, excessive crying or baby seeming more uncomfortable than usual during diaper changes, swelling in the genital area. When you notice one or two of these symptoms, make sure you make an appointment or you schedule an appointment with your pediatrician or your doctor. Let me repeat these signs: fever, blisters around the diaper area, pus or discharge from around the diaper, rash that doesn't respond to treatment, excessive crying, or baby seemingly more uncomfortable than usual during diaper changes, swelling in the genital area. A point to note: bright red raw skin can be a sign of a fungal infection and also cause for a trip to child's pediatrician. Bright red, this is very important. Bright red raw skin can be a sign of a fungal infection and also cause for a trip to your child's pediatrician. Another point to note: your baby's diarrhea should never be red or white. The diarrhea should never be red or white. If it's red, it might be containing some blood. You should call their doctor if you notice either of the above colors, red or white. Another point to note: contact your pediatrician if you notice either of these colors in your baby. If you see reddish color, which might be a sign of blood, all white, contact your baby's pediatrician. Contact the pediatrician. This is another point. Contact your pediatrician or your baby doctor if, number 1, baby has severe diarrhea. Number 2, if diarrhea lasts more than few days. Number 3, if your baby has more than 10 watery poops per day. If your baby has more than 10 watery poops per day, you should seek medical advice. Let me repeat this one. Contact your pediatrician or see your doctor if, number 1, baby has severe diarrhea. Number 2, if diarrhea lasts more than few days. Number 3, if diarrhea lasts more than few days. And the last point, if your baby has more than 10 watery poops per day. A question we can ask ourselves: can yogurt help prevent or treat diarrhea? Most of us love yogurt. A lot of young children love taking yogurt. So, can yogurt prevent or treat diarrhea? Certain types of yogurt contain friendly bacteria, also known as probiotics, which may help treat diarrhea. Certain types of yogurt contain friendly bacteria, also known as probiotics, which may help treat diarrhea. Studies show that consuming probiotics in the weeks leading up to a trip may reduce the risk of traveler's diarrhea. Studies show that consuming probiotics in the weeks leading up to a trip may reduce risk of traveler's diarrhea. Studies also show that probiotics may shorten the length of diarrhea caused by bacterial, viral, or parasitic infections. Studies also show that probiotics may shorten the length of diarrhea caused by bacteria, virus, and parasitic infections. Also, studies indicate that taking probiotics alongside antibiotics reduce the risk of diarrhea by up to 51%. However, their effectiveness may depend on age. For example, it's most effective in children than the aged or the adult age. Let me repeat this one. Studies also indicate that taking probiotics alongside antibiotics reduce the risk of diarrhea by up to 51%. However, their effectiveness may depend on age. For example, young children may respond more well than the elderly. This marks the end of our first video today. And in the next video, we will talk more about these probiotics or these good bacteria. So my people, let's continue subscribing, liking, and sharing our videos so that they may reach as many people as possible. Have a good evening.